He wasn't supposed to be alive, not with what was missing. Most people need their brain to think, to feel, to remember. He didn't have most of it. Doctors saw the scan. Then they looked again. Then they stopped talking. Where a brain should have been, there was space, dark, quiet, almost empty. Yet the man was standing, talking, answering questions, living a normal life. No machines, no miracle surgery, no explanation. That's when the question changed. Not, what's wrong with him? But, what do we actually need to be human? Because if a man can live without most of his brain, what does the brain really do? And how much of it can disappear before we disappear too? This isn't a story about survival. It's a story about absence and what happens when the body keeps going after the mind should have been gone. He didn't come in for anything dramatic. No collapse, no seizure, no emergency. Just a routine visit, a minor complaint, something that usually ends with a prescription and a goodbye. The doctor ordered a scan, not out of fear, out of habit. The machine hummed. The room stayed quiet. Then the image appeared. The doctor leaned closer, not in panic, in confusion. Something was wrong, but not in the usual way. There was no sign of injury, no trauma, no bleeding. There was simply less. Where the brain should have been, there was fluid, space, silence. The doctor checked the name, checked the date, checked the patient ID. Then they checked the hallway. The man was sitting there, calm, alert, filling out paperwork, alive, aware, waiting. The scan stayed on the screen, unchanged, unarguing. That was the moment, not when they saw the image, but when they realized the man in the waiting room and the scan on the screen did not belong to the same person. The brain wasn't damaged, it wasn't injured, it hadn't shrunk overnight. It had never been there. Most of his skull was filled with fluid, cerebrospinal fluid. The tissue was compressed, pushed aside, reduced to a thin layer. In another patient, this would mean severe disability, loss of consciousness, death. But not here. The man had gone to school, held a job, built a life. No one noticed. Not teachers, not doctors, not even himself. Because the loss wasn't sudden. It was slow, quiet, invisible. His brain didn't vanish. It was displaced. And somehow, what remained was enough. Enough to think, enough to speak, enough to live. The scan didn't show a miracle. It showed a contradiction. And medicine doesn't like contradictions. Doctors gave it a name. Not a solution, not an answer, just a label. Severe hydrocephalus, a buildup of fluid, pressure over time. The diagnosis explained how the brain disappeared. It didn't explain why the man was still there. No textbook prepared them for this. No chart accounted for it. Medicine is built on averages. This man was an exception. His brain had adapted, reorganized, compressed function into less space. Not because it wanted to, but because it had to. And somehow it worked. But the question remained. If the brain can do this, what else can it survive? What else can it lose? And how many people are walking around right now with something missing that no one has noticed yet? We like to believe the brain is precise, that every part has a role, that remove enough pieces, and the system collapses. This case says, maybe not. Maybe the brain isn't a machine. Maybe it's a negotiation, a compromise. It doesn't ask for perfection. It asks for continuity. As long as signals move, as long as something responds, life continues. This man didn't prove the brain is unimportant. He proved something more unsettling, that we don't fully understand what enough really means. How much memory is enough? How much awareness? How much self? And if the brain can adapt this far, where is the line? Doctors monitored him. They protected what remained, but they couldn't answer the bigger question. Was he missing something he never knew to miss? A thought he never had? A feeling that never formed? Or was his experience of being human simply different, not broken, not incomplete, just other? Medicine can measure tissue pressure fluid. It can't measure absence. This story isn't comforting, and it isn't meant to be, because it leaves us with a dangerous idea that the body can lose more than we think and keep going. That normal isn't a fixed point, it's a range, and somewhere in that range, this man existed. So the question isn't, how did he live without most of his brain? The question is, how much of us could disappear before anyone notices? And if it happened slowly, quietly, would we even know what we had lost?